Hi, and welcome to our Fluent Balance case study. Mrs. Davis is admitted to the hospital after 5 days of vomiting. She has been unable to eat anything for that time period. Her usual weight is 126. On admission, her weight is 118. Assessments reveal dry, cracked lips, poor skin, Truger. BP is 88/72, pulse is 102, respiratory rate is 20, and temp is 38.6. Urine output over the next 8 hours is 100 milliliters.
Hypovolemia is an abnormally low level of extracellular fluid caused by either loss of salt and water or excessive loss of blood. Untreated hypovolemia or excessive and rapid loss of fluid or blood volume leads to hypovolemic shock. Some symptoms of hypovolemic shock include oliguria or low urine output, low blood pressure, and pale skin, each of which Mrs. Davis is or is likely to be experiencing. Oliguria is defined as a urine output of less than 500 milliliters a day for adults. At the rate Mrs. Davis is passing urine, she'll have an output of 300 milliliters in 24 hours, fitting a diagnosis of oliguria. Regarding blood pressure, anything lower than 90 millimeters of mercury for the first number or 60 milliliters of mercury for the second is considered hypotension or low blood pressure. Mrs. Davis' blood pressure is at 88/72 millimeters of mercury, putting her in the range for hypotension. Finally, while it is not explicitly stated whether her skin is pale or not, this is a likely symptom considering her other symptoms.
So the evidence of her body compensating for the loss of fluids, as we could see that she has been vomiting for 5 days, so it shows that she's dehydrated, and her dry cracked lips and poor skin. Her blood pressure is high or low, and her heart rate is high, and she has a low urine output. And from the lab results, we could see that her sodium and potassium levels are below the normal levels, but her creatine levels are above the normal levels, which can cause her cause dehydration. The mechanism that is involved in this is the antidiuretic hormone or ADH. So this happens when the hypothalamus will activate the thirst mechanism due to the signals of the dry cracked lips and the low saliva production and low BP. So then this will also activate the posterior pituitary gland to release the ADH hormone, which will act on the nephrons of the kidney and will cause the reabsorption of water and decrease the volume of urine output. After the ADH hormone has decreased the plasma osmolarity and increased the urine osmolarity, the receptors of the hypothalamus will inactivate and the ADH will stop secreting.
We know that Mrs. Davis passed 100 milliliters of urine in 8 hours. If this loss continued at the same rate, she would pass 300 milliliters in 24 hours. Considering the fact that the normal rate of urination is between 500 and 2,000 milliliters a day, and oliguria is defined as a urine output that is less than 500 milliliters a day, Mrs. Davis' output is concerning. Mrs. Davis is in fluid imbalance from her continuous vomiting and lack of intake for 5 days. Some other common causes for fluid imbalance include diarrhea, severe blood loss, high fever, profuse sweating, and liver or kidney problems. With the exception of the latter, these issues can cause extreme thirst and dehydration, while the liver and kidney problems can cause fluid buildup in the body. This buildup can eventually lead to edema, defined as excess fluid in the skin and tissues.
Hyponatremia is a rise in serum sodium concentration to more than 145 millimole per liter and is common electrolyte disorder with increased mortality, especially in the elderly. It can happen because of the limited access to water or damage in thirst mechanism or rarely diabetes. Hyperthermia is usually combined with hypovolemia, which is a decrease in the volume of blood plasma, and both of water and solute lose, especially the water. To prevent this, the body tries to conserve the fluid by causing the cell to swell in order to reduce the fluid loss.
So normal sodium levels are between 135 and 146 milliequivalents over liters, and the normal potassium levels are 3.5 to millimoles per liter. They are needed to maintain the fluid balance and osmolarity in the body, and the potassium ions are found in the intracellular, and the sodium ions are found in the extracellular.
Sodium, potassium, phosphorus, calcium, magnesium are most common electrolytes in our body. There are food that can be source of these electrolytes. Seafoods like fish can be source of sodium. 178 gram of fish can have 109 milligrams sodium. 125 gram of banana can have 422 milligram of potassium. Also, nuts can be source of phosphorus, like 100 gram of sunflowers can have 660 milligram phosphorus. Milk cheese can be source of calcium. 1 cup of milk can have 305 milligram calcium. Green leaf like spinach can be source of magnesium. 100 gram of spinach can have 79 milligram of magnesium.
Feedback loops for water balance. Main perturbations of physiological responses to hypotonic dehydration due to a negative water balance. Solid arrows show the responses induced by osmoreceptors when plasma osmotic pressure increases. Dash arrows show the corrective mechanism induced by insufficient water intake and decreased blood volume to restore blood volume and blood pressure. Note that in the case of hypotonic dehydration due to a positive water balance, all perturbations and physiological responses that are induced occur in the reverse direction.
Mrs. Davis fluid imbalance is associated with hyponatremia, also known as low blood sodium, and hypokalemia, which is low blood potassium. We saw from her lab results that her sodium and potassium levels have dropped below their normal levels due to her constant vomiting. Blood sodium typically ranges from 135 to 146 millimoles per liter, and Mrs. Davis levels are at 126 millimoles per liter. Meanwhile, her potassium levels are at 2.9 millimoles per liter when they should be between 3.5 and 5 millimoles per liter. If these imbalances continue or get worse, Mrs. Davis could suffer from muscle cramps, seizures, or even cardiac arrest, ultimately leading to an increased risk of death.
Diminution of thirst. Elderly people are more at risk for dehydration. Diminution of thirst is one of those reasons. This decreases the renal ability to concentrate urine. Also, underlying health problem can be the other reason. Elderly may face difficulties in accessing drinks due to limited mobility, visual impaired, swallowing disorder, cognitive alternation, and use of sedative. Also, fear of incontinence can lead elderly to decrease liquid intake, low dietary intake, decrease water intake. Also, old people use more medication than younger people, so intake of diuretic or laxative can increase water loss.
So the conclusion or diagnosis that we come to is the stomach flu. And we come to this conclusion because the common symptoms of the stomach flu are nausea, vomiting, weight loss, dehydration, fast heart rate, low urine output, which Miss Davis had shown all the symptoms for this. And her creatine levels were high, so that also contributed to the dehydration and low blood volume. Her vomiting also led to her low levels of electrolytes and is associated with hyponatremia and hypokalemia. Uh, Her body is trying to compensate this by decreasing her blood pressure and increasing the heart rate. And Mrs. Davis' low output of urine is her body's way of compensating for her loss of fluids. So it is also trying to limit the amount of fluids that is escaping her body. So the next step that we would do is put her on IVs because she has lost a lot of electrolytes, a lot of fluids, and her low blood volume and her electrolytes are very low. And we would run a stool test to see if there's any potential viruses, bacteria had entered her body, and to see the nutrient absorption. So here are some questions. What are common symptoms of hyponatremia? What kinds of foods are sources of electrolytes in our body? What are the signs and symptoms that Miss Davis is hypovolemic? What are some common causes of fluid imbalance in our bodies? How is hypovolemia associated with hyponatremia? And here are some of the sources that we use to conduct this study. And yeah, that will conclude our presentation for the fluid balance case. Thank you.